Ms. Jones.
Hello.
I'm Nikki. I'm gonna be your nurse today.
Okay.
You okay?
No, my ear hurts.
I'm sorry. I'm gonna get you some. I'm gonna get the vitals on you, and then I'm gonna ask you some questions, okay? And that'll help the doctor when she comes in to examine you.
Okay.
Okay? Let me just wash my hands real quick. Alright. Can I take a blood pressure on this arm?
Sure.
Okay, good. Sorry if my hands are cold. Okay, you can just relax it right now. Okay, make it tight, okay? Okay, 124/86. I'm just gonna check for your pulse now. Okay. Okay. I'm just gonna check your temperature. Okay, then I'll get. Okay. So you have a little bit of a fever, 99.8. Right. So you did tell me that you have an earache, so that's what brings you here today? Which ear is hurting?
It's the right ear.
Have you, how long have you had the pain?
It's been about 3 days.
Yeah. Okay. Can you tell me what type of pain it is? Is it sharp or dull? Has it?
It's dull, but sometimes it's sharp, depending on how I move my head.
Is it staying consistent or does it ease up at times?
No, it's consistent.
Okay. Are you having any ringing or crackling in your ears?
No ringing.
Okay. What about any dizziness or like balance problems?
Yeah, dizziness sometimes, depending on how I move my head.
Okay. And then the balance
Yeah,
when you stand up?
it kind of makes me dizzy, yeah.
Okay. Have you noticed any hearing differences in one or both ear?
Yeah, my right ear is clogged up a little bit. I'm not hearing as well as I was before.
Nothing's helping with that? Like if you stand up or sit down or turn your head or anything?
No.
Okay. Have you had any problems lately with your allergies?
Yes, I have.
Okay. When did that start?
It's been about a week.
Oh, okay. Have you runny nose, stuffy nose, cough?
Yes.
Yes to all of them?
Yes.
Okay. Have you noticed any drainage from your ear?
No drainage.
No. Okay. Do you have trouble with your earwax buildup or any kind of earwax problems?
Not really. A little bit, not.
Okay. Do you have history of frequent ear infections?
I had one maybe 3 years ago, I remember.
Yeah, okay, so not recent
No,
then.
it's not recently,
Okay,
but I've had them before.
okay. Are you currently taking any medicines? Like over-the-counter medicine?
Tylenol for pain.
Okay. When was the last time you took that?
This morning.
Okay. How many did you take?
I took 2.
2. Okay. Okay. All right, Miss Jones. I'm gonna get the provider. She'll be in here in just a few minutes. She's actually gonna do an examination on you. She's gonna look at your ears and everything and see if you need some medicine.
Okay.
Okay? All right.
Hi, Miss Jones.
Hello.
My name is Jenny. I'm one of the providers here. So I've noticed that she came in and you said that you're having some ear pain. Is it both or just one?
It's my right ear.
It's more on the right side? Okay. Let's see. And you do have some history of some ear infections. Was it more on that right side?
Yes.
Okay. Let's see. When did this start?
I probably
about
had my
3
last ear infection in like about 3 years ago.
Okay. And you said you're having a little bit of hearing loss in that right ear? Okay, so what I'm going to do is I'm actually going to do a physical exam on you, okay? So we're going to test like your hearing, and I need to see inside your ear to see if you have any wax buildup, or any fluid in your ears, or anything's going on with your eardrum, okay? All right, let me wash my hands. Get me some gloves real quick. So are the ears tender or,
Yes.
okay, on the outside or inside?
Both.
On both, okay. I'm actually gonna look at your left first. On here. Now is that tender when I touch it?
No.
Okay. So I'm looking at your pinna right now. Does that hurt when I pull it like that?
No.
Okay, I'm gonna look on the back. So it looks good. No dry skin, no abrasions. I don't see anything. No, no cuts or scrapes or anything like that. The color looks good and smooth. Alright, let me look on the other side. So this is the one that was kind of hurting, right? Okay. So that hurts a little bit?
Yeah.
Okay. So this one looks good on the outside too, but it may be more internal. So there's no, nothing coming out, no fluid coming out, no redness out here, no tender. It's a little tender on the outside, right? Okay, but I don't see any cuts or anything like that, so that's good. No bleeding or anything. All right, so I'm gonna check your lymph nodes to see if they're a little swollen. So these are your pre-auricle lymph nodes. So it's a little bit more on this side. I'm gonna go down here. Does that hurt? Is that tender?
On the right side.
A little. So that right side's really giving you some trouble, huh? Okay. All right. Well, let me get my otoscope and check you out. So this has a light on it. Okay. This is where I'm gonna check the inside of your ear, but I'm also wanting to check the canal, okay? So I'm going to start with your left first, because I want to compare. I'm going to pull up and back. You get a little bit of wax buildup. Can you hear out of this one okay, though? Okay. Alright, I can see your tympanic membrane. It's a little shiny, little pearly kind of look, okay? Right, but I don't see any redness or fluid in that one. Let's check this one. This one was a little tender, so I'm going to pull up and back to get the canal a little bit easier to look in there. Yeah, you got a little fluid in there and some redness, so I bet this is a little wax buildup. but I can see our membrane. It's just there's some bubbles in there, so that's probably where that's coming from. Okay. Okay, so you said you're having some trouble like with dizziness and some hearing too. All right, so this is a tuning fork, so it doesn't hurt. So what I'm gonna do is I'm gonna hit on the palm of my hand, and this is to check your hearing because I want to make sure that it's not neurological. That's more due to the fluid buildup. Okay, so I'm gonna hit on the palm of my hand. I'm gonna stick it on top of your forehead, and what you're gonna do is you're gonna tell me if you can hear on equal sides. Okay. Can you feel that on both sides?
More on this side, on the left side I hear better.
Okay. So now on this one, there's gonna be another hearing test, okay? And this is the Reining test. So I'm gonna check what is called your mastoid bone right here, right behind your ear. And then I want you to tell me what you hear more out of. Like when I do it on the back, and then I'm gonna move it to the front. Okay, I'm gonna do it with both ears. First your left. Tell me when you stop hearing it.
I still hear it.
Okay.
Okay. I hear it.
Good. Okay, now let me check the right ear. We're gonna do the same thing. So I'm gonna press this against the back of your ear, and then you're gonna tell me when you stop hearing it, and then I'm gonna move it to the front of your ear, okay?
Okay. Okay.
Okay, good. So it looks like those are good, because you wanna hear more air connection than bone connection. That's what I did. So this was your bone. Okay? Alright. So what I'm going to do now is the whisper test. So this is me checking for like if you can hear me whisper certain numbers or letters. So what I want you to do is I want you to close that right there. Like put pressure right there on your ear. And I'm going to come over here and I'm going to whisper something and I want you to repeat it, okay? Okay, ready?
I can't really hear it.
You can't hear that? Okay, let's
I
try the other
know
side.
you said something, but I couldn't really hear it.
Okay, let's try the other side then.
Okay.
Like that one. Put pressure on it. Here, I know it hurts, but I'm gonna move this chair a little bit. Okay, here we go.
3, 2, 1.
Good. Okay, so it looks like that right ear is really full of fluid, okay? It's possibly infected. There was some redness, and then you had some swollen lymph nodes here and then behind the ear. So what we're gonna do is, I advise you still take your allergy medicine. I think that'll help. But we're probably gonna go ahead and give you some ear drops for the pain, and then some antibiotics to help that. Okay?
Mm-hmm.
All right. And if it doesn't get better, then you need to call us or come back.
Okay.
Okay? Okay, Ms. Jones. So you've had ear infections in the past, and this one's obviously not feeling too good either. You have some acute pain, so the pain will go away with, proper treatment. But it's related to all that inflammation and that infection in that middle ear, okay? And how I know that is because there's a lot of fluid built up in there and the redness and inflammation. So that's why we're gonna give you the ear drops and stuff, and that will treat your pain also, okay? Do you have any questions for me?
No, that's
No?
about it.
Okay, well I hope you get to feeling better. And if you need anything, just give us a call. Or if
Okay.
it gets worse. You don't want it to get worse, okay?
Thank you.
All right.